And after all things sports, we have to thank Benedict Owusu and the rest of the team for that great insight into all that had been happening in sports over the last 48 hours, I believe. But please make sure that you'll keep up with Benedict Owusu and the rest of the team later in the day when they bring us the latest in sports. But now let's talk about all the things we've been talking about this morning. It's about a latest documentary going to be premiered right here on the channel and Maps. That's a great thing because we have our own Seth Kwame Boateng seated here. And I always say Seth is one of the big journalists, great journalists, impacting people's lives. And that's what we have to do as a society. The thing is that with the needed resources, we could even do better. So that's a great thing about it. Well, Seth.
Welcome.
Thank you.
Yeah. All right, so today we're talking women in battle.
Women in battle.
Women in battle. So give us more about that.
Okay, so every day, let's say today, about 830 pregnant women will die in the world. 830. Half of this is coming from developing countries, and 99% from sub-Saharan Africa, including Ghana. And here in Ghana, they are compelled to, it's a battle between religion and culture. And at times, preeclampsia or pregnancy-induced hypertension. But for the past 6 months, I've been touring Ghana, understanding why women die when they go and deliver or when they are pregnant. And I got shocked when I visited some of the communities and I realized that in the name of religion, they are dying. That they have been brainwashed such that they've been made to understand that when you are pregnant, you don't have to go to hospital. You should rather be at a prayer camp throughout your pregnancy and even deliver there. One woman I interviewed and I was shocked, literate, educated. Educated. She came to that prayer camp to deliver. And I got there a few minutes after.
If you say education, what sort of education? Formal schooling?
Yeah, formal schooling, at least up to SS, SHS. So
that's
you're
education.
educated.
Yeah.
You understand? You understand. She speaks very good English. And I asked why she came to the hospital to deliver. Well, my first child, I went to the hospital. It wasn't easy. I was told when I come here, oh, I'll have it smooth. And indeed, I had it smooth. No complication. Yeah.
In Ghana?
In Ghana.
Okay.
Greater Accra region, that down stretch along the coast. You have a number of churches, prayer camps.
A dozen of them, or just
plenty.
Scattered around.
Scattered around.
And where are they located? In communities or in
communities?
In vegetative areas?
In communities. So, for example, one community, you may find about 10 prayer camps there. They all conduct deliveries. And you should see where they do it. They have nothing to protect themselves, so their bare hands and all those things. It's pathetic. And one story I was told, a woman who went to one of the prayer camps to deliver, you know, not knowing the baby was, is it hydrocephalus? Is that the right pronunciation?
Hydrocephalus.
Okay, so it should
that's
have
having water in the
brain. So the head was very big, very, very big. So this woman should have
the baby treated immediately.
No, it should have been CS, cesarean section. Yeah. But she went to the prayer camp. She was told you have to deliver here because when you go to hospital, you die. So the woman started pushing. The legs came. The baby got stuck. The head couldn't come. They had to then put her in a taxi straight to Bator Hospital. She was lucky they were able to save her life, but the baby died. I met another man whose wife got pregnant. He forced the wife to go to hospital. They took the scan and everything, but she came back and stayed at the prayer camp. The husband went there several times. Let's go to hospital. She said no.
She was still ambivalent.
Yes, I've been told when I go to the hospital I will die. So I will deliver here. So one day the husband was there and it's
dawned on him
that no, the time they gave us when we took the scan, the time they gave us has elapsed. So let me go there. The woman said no. The prophetess said no. So he went back, informed her family, the wife's family. That is what she's saying. So let's go help me and take her to hospital. So they used force, took her to hospital, not knowing the baby had died days in the stomach.
In Ghana?
In Ghana.
Well, let's just get some excerpts of that documentary, and then when we come back, myself and Maps will be asking some key questions on this.
A mental health nurse at the Pasa Health Center, Emmanuel Nate, confirmed epilepsy cases are high in his area because of these delays.
Once they are delivering in the house, the environment may not be very clean, so there may be infections that may set in. It will also go into affect the brain, which may lead to epilepsy or mental disorder. Or when the child delays in perineum or in between the mother's side before it comes and is not able to receive oxygen adequately, it can also affect the brain tissues or cells, which may also lead to mental disorder or epilepsy. And that has also resulted in the high epileptic cases in that part of our district.
Thanks to intensified education and advocacy, the tables are turning now.
The good thing about the whole situation is the traditional authorities are in favor of intensifying our education to their people. So we have the support of the traditional leaders, and it is beginning to yield results.
These results show in the number of pregnant women who are now visiting health centers for delivery. Thanks to the community-based health planning and services initiative popularly called CHIP centers, the lives of these pregnant women are being saved. Director General of the Ghana Health Service, Dr. Anthony Nsiasari, is excited with this.
Now, CHIPS is our lowest level of healthcare. We want to make sure that every CHIP center, at least every CHIP zone, covers about 5,000 population, so that people can get to a trained, skilled person to deliver.
Well, I have just arrived at Bonache CHIP Center, which is one of the 37 community-based health centers in both the Nkwanta North and South District. And what is happening here now confirms that the education is working. A lady is in labor and has come here to deliver. Labor is always painful. No wonder the midwives are pampering her and doing everything possible to soothe her pain. She is called Martha and she looks restless and insists visiting the toilet. Well, it's a sign that the baby is almost out, so she cannot leave the delivery bed. Martha's mother is around and she equally looks restless. Martha has fully dilated and needs all the energy to push at this final lap. She does that and boom, the baby drops. It's a boy and everybody here is excited. Her mom is beaming with smiles and her husband Aliu has just arrived and he's equally excited. The baby came a few minutes after he left here to go and eat.
Serious. Oh, manya will Friday, manya Japan, manya. I met my friend one day as one and I made it. Tell me the pounds, manya will fry.
Now, Obana Bema.
Bema.
They didn't say, and now Yantunidi.
They didn't buy it.
And it appears Martha has soon forgotten about those labor pains moments ago.
I come here.
Obesa wotre.
Fashion.
Awo yesi awo nye yakura ana besa wotre no.
Yeah, nsumi here phone tino.
Uhia phone.
Fashion.
Adena uhia phone.
Sansa me wo phone na meji me hwe ho so. Nti na me pe phone be ho.
Until your firstborn.
Pacha.
The insight into why many of those pockets of so-called churches and camps that are headed by so-called prophets really have to keep pregnant women in there. And how does it become a cultural issue after all? And Seth Kwame Boateng had been telling us. Now, when we watch that clip there, especially when we were talking about Basa, etc., it means that women had to go through a lot to access health. Yes. Was that the situation you found?
Yes. And so some of the roads are no more trouble, so they have to rely on motorbikes. Now they have what we call motorcanes, turned into ambulance. You know, those motorcanes, they've made some ambulance that they used to transport.
You mean the Mahama Kambu?
The Mahama Kambu. So that's what they are using. And I remember one of the villages, is it Bonache, that I visited, Bonache. Even network is a problem. Network is a problem. So when a pregnant woman is
in labor, mobile network.
Mobile network. So when a pregnant woman is in labor, you have no vehicle to take this woman to the hospital. So how to even get a vehicle to help take her to another facility is a problem.
Wow.
So they die. So they delay and they die. One doctor, nurse I interviewed, that in his area, epilepsy cases arrive because of the delays. The woman is in labor. They have to transport this woman to a very hospital, health facility. So they get there, and another story.
Well, so now we know that this also means that under 5 mortality is always high in some regions or areas of our country. Is that true?
No, it's true, because I think they are related. When the mother is safely delivers, it affects the baby. It impacts on the health of the baby. The otherwise is the situation. And because my focus was not on under 5 mortality, I can't talk much about that. Maybe a doctor will help us. But the statistics I gave earlier about we having about 830 women, pregnant women dying every day, with 99% from sub-Saharan Africa, including Ghana.
And that's serious.
And that's very serious.
Well, so we've been joined by Dr. Chris Opoku-Fofie. He's an obstetric gynecologist with what is now the Greater Accra Hospital.
Yes,
it's a regional hospital. Regional hospital. That's a great one. Thanks for joining us.
Thank you.
I'm to start the conversation with you. That's
okay,
it.
That's fine.
So I want to know, how's the country doing in terms of rates? Are there other regions that are doing better? And if so, why is the case?
Okay. For now, we are not doing very well. The cause of maternal mortality, when you follow it, initially we were looking at the MDGs. And at the end of 2015, we really didn't achieve our objectives, whilst other countries within the third world were able to come very close. Notwithstanding, we've come out with the Sustainable Development Goals, where the target now is to be able to get below 70 maternal deaths per every 100,000. That's quite ambitious, and if we didn't achieve the first one, that is reducing by 3/4 within that period, 1990 to 2015, we then have to double our efforts to be able to come close to this Sustainable Development Goal. So for now, I would say we're not doing very well, but it's an opportunity on its own to re-strategize and propel ourselves on a wider stage to be able to meet this target. Yeah.
Well, it would also mean that perhaps questions will be raised. Do we have the facilities? Yeah. Do we have enough of the hospitals? And there'll be questions also about access. How is that?
Yeah, we have problems at all these levels, and classically we tend to use the delays, because we say, why do women die? Then we realize that at the heart of all deaths, we'll find some level of delay at the level of decision making of the woman, delay at the level of having access, going to the facility, and even within the facility, when they get there, we still have delays. Currently, in the Ridge Hospital, for instance, we are overwhelmed by cases that come because many people want to come and experience the good environment that we have there, and as a result, every time we then have so many people who come and do not have bed space, so they have to wait long times, and in such situation we could have complications coming, even though they are in the facility, they've gotten there early enough, but they cannot be attended because we don't have. So these are not the entire picture. We have other areas like social determinants of health, where we know that the situations or where people are born, where they grow, where they work, where they live, determine the type of health condition they have. So that people living in other parts of the country tend to perform poorly in terms of maternal health due to the very environment in which they find themselves. So such health inequalities or inequities must be addressed. These are social determinants, right? So as we are looking at increasing the number of health facilities we have and increasing the bed capacity, we also need to be addressing education for our women, planning, strategic planning, because we have situations where people will say they don't have money, but they budget for the clothes that they will wear when they deliver, yet they don't have money allocated for the emergency care, which is critical for them. So when they get there, we understand that we need to empower our women to make informed decision on how to prepare. So that's what we call birth preparedness. And we've been working on all these strategies, yet we've not gotten there yet. So it's about probably changing the way we do it and struggle a bit harder.
It reminds me of something I noticed when I went to Boko as part of this documentary. Yeah, you know, up there, the men have more than one wife. They marry more than one. So maybe a woman has 3 wives. All the wives delivered home. They didn't go to hospital. So you, the 3rd one, you come in, you are in labor, and you want to go to hospital. It means you are weak. So to prove that you are strong, no matter the complication, you want to deliver at home.
Okay, if we say home, what do you mean by home?
They are not the hospital, not
the place of residence.
Place of residence.
So they just have a room for you to deliver.
Traditional bed attendants to come and help you deliver without going to hospital. It shows that you are strong. But if you opt to go to hospital, it's a different story, and you wouldn't want anybody to tease you at home. So you may have noticed or seen some of these things in WA. You said you were in upper west.
Definitely. Like specifically in WA, delivering in the home or in the midst of your peers is seen as a sign of being strong. Labor on its own is seen as a day of reckoning, where the evil that a woman does then will be taken to book on that day. So if, for instance, it's suspected that you've been unfaithful to your partner, your labor could be prolonged and you could have complications unless you confess. So in such a situation, you just have to quickly go to the hospital so that you don't have to confess in the midst of everybody. So there's this tendency that when you say you want to go and deliver in the hospital, it creates an impression that you've hit below belt, and that is why, notwithstanding, a lot of work has gone on. There have been a lot of NGOs doing fascinating work, and I think some of these beliefs might not be as they were years back when I was there.
So in some of the communities I visited, it has come down. There's the reason when we saw the clip we saw, I met this young lady at the hospital who had come to deliver in the past. It wouldn't have been that. But the education is helping. That I mentioned to you off air about how the CHIPS compounds are helping.
Yes, you did.
The CHIPS compounds.
Are they really helping?
Yes, they are saving lives.
I thought politically we always make some.
You see, it's about time we put politics aside. I'm telling you, I went Bonache community in Kwanta area. One midwife had conducted 200 deliveries. 200 deliveries.
Within a space
of like 6-7 months, 200 deliveries. Imagine if they didn't have that facility there. They would have delivered home by their traditional birth attendants.
And that would have been dangerous.
When they face complications, they die. The infections and all these things. I'm telling you, the CHIPS compound, one other village I went in the Jintinga. Sorry if I butchered the name. Yeah. No, they have the CHIPS compound there, but they can't conduct deliveries there. There's no midwife. And they are cut off when it rains. So when you are pregnant, they will tell you, move to the other town. Don't stay here. That is in the rainy season. Move to the other town, because when labor starts and it's raining, we can't cross. Yeah. Which is very sad. All the same, they go there for antenatal and all these things. So the education is helping. And one fantastic thing I noticed in Nkwanta, I understand here in Greater Accra, they're also doing it, is the use of WhatsApp. How WhatsApp is saving lives.
You mean by we're communicating, getting in touch with each other?
So in Nkwanta, for example, led by Dr. Lord Boatin and his people, they've created WhatsApp platform. They've put all the midwives and in all the CHIPS compound on that platform. All the consultants in the district are on that platform. The regional director of health is also there. So anytime a case comes to you and it's a Bearview, you just put on the platform, we have this case. Quickly, they'll respond, do A, B, C, D. If it's getting worse, they will tell you refer. So you put the referral notes on the page. You understand? Okay. So by the time you get to hospital, it's not now that they have to go to the theater and prepare this. They know your history before you get there.
Because already it's on the platform.
Yes, so they would have prepared for you as soon as you get there, if they have to send you to theater straight away.
Well, Dr. Fufie, why is it that, based on what the colleague has found out in this investigative piece, is that we have a certain socio-cultural as well as religious impact of what people believe or not in maternal mortality?
I think it's historical. In our bringing up, Ghanaians in general, we tend to be superstitious, and we always know that in difficult times, everybody finds something in which to believe. You think anything beyond you, you get something higher or stronger than you to come to your aid. So as a result, we've gotten people to take advantage of that vacuum there and offer certain services. People that can even predict and tell you that you might do this A or B before you can have safe delivery, and prepare all sorts of concoction for pregnant women. And at the end, majority of women will deliver anyway, with or without help. So it appears that those who patronize such facilities, some end up successful, but it's just a matter of natural law. So the other way will have been if we are able to put a more comprehensive system where every woman will be covered. Because in obstetrics, what we're talking about is the emergency delivery, where you need the skilled attendants and the attendants. That is a place where you have a conducive environment and people with the requisite skill to offer that particular support. As we stand, we are overwhelmed across board. Everywhere you go, even in Ridge Hospital, where we don't have the capacity to attend to all the cases that come. So the backlog definitely will find other places, and that is where the quacks or the spiritualists are taking advantage of and doing. So for me, the way forward is to be able to have a system like he mentioned, the CHIP compound, which is coming as a very good intervention, but then the missing link here is to make sure that at every CHIP compound we have somebody with the requisite skill to provide the skilled attendants that we need. I mean, if there's a midwife there who can do deliveries and attend to the basic complications that can come, and also be supported by a team of people at a different level that can then address the complications that emanate from such a level, then we'll have a robust system, and we might not, we'll weed out the quacks and all the others. But as it stands, we are not doing that. So we have a lot of buildings called CHIP compounds, but we might not have a skilled person there. So people go there, the outcome is negative, and they think that probably it's not nothing special to go to such place after all. So these are my thoughts on this.
Okay. So Seth, let me come to the prayer camps. I mean, my great-grandmother, my great-aunt gave birth at home without any complications. And then now, why are we having complications? Are they using different methods, or do you understand?
Are you talking about the preeclampsia or the cultural?
The cultural, yeah.
You know, I don't know how they did they did it in the past.
Yeah.
And in the past they still had a traditional bed attendant, right?
Yes.
Assisting them at home. But you know, things have changed. We have modernized, and probably the kind of life we are on now seem not to be helping us. You understand? So we may find difficulties. I'm not a medical doctor, so we may find difficulties which will warrant that we go to hospital and do it. But we still have these thoughts, the traditional ones and other things back here, and which are not helping.
Well, Doc, is it because the babies now in the womb are bigger, etc.? Because maybe we're taking more KFC and all that. So.
Yeah.
It's possible. Here we don't have strict evidence to support that, but the fact that our nutritional pattern has changed, it's obvious that the babies now are more well nourished than they were previously. In the past, majority of the people would deliver preterm babies that will end up being kwashiorkor and all that. Now they are able to attain significant size. But putting that apart, we know that in the past, these deaths were also there. Women enter into labor and they do not return. There's enough evidence to support that women have been dying across all geographical regions during labor and from hemorrhage and things like that, where a magnificent building like Taj Mahal was dedicated to the wife of a king who died from labor. So it has happened and it continues to happen. So even in Ghana here, we see a lot of people in the past were dying. The only thing is that we didn't have radio, we didn't have TV to synchronize and gather all that information. It stayed in one village.
And data too was not well collected.
That is it. Now one woman dies in Rage, for instance.
It's on Facebook.
Yes, and everybody in Tamale, Axim will hear about it. So it's a way of gathering our information.
There's maternal audit.
Audit and all that.
So now, Seth, woman in battle, this is what you found out. Where to from here? What needs to be done?
Well, education and resources. We live here in Accra. We are here in Accra thinking that we are doing much, or we are educating people. The education is getting to them. I'm sorry. From what I've seen, we are not doing enough. I think it's time we got our public health doctors, nurses dispatched to the villages. You understand? Yeah, but I wonder how many of them will go. Dispatch there to really educate them. It's about time we resourced the CHIPS compounds. You understand? It's about time we worked on our roads. Where some of them are, takes hours. 3-4 hours when you're pregnant, you're in labor, and it takes about 3-4 hours for you to be on motorbike to the nearest health facility. The woman might have died by the time she gets there. And it happened in Bako. One doctor confirmed to me that when I went there, 2 pregnant women had died because where they were coming from was far.
And by the time they got to the facility,
yeah, they were dead on arrival. So it's about time we paid attention to our roads. It's a major challenge. And education. And yes, prayer is good. Prayer is good. But it doesn't mean that God gave doctors the brains to work on us. You understand? I'm not saying
it's not as if the doctors are evil.
Exactly. God knows why.
Divine healing.
Yeah, education really is important. My experience
divine
is
healing.
In the past, we look at education as something that you package from one end and transplant at a different end, instead of having that context-specific education where people live in an area. They are a bit, they will be better off if they get people within that locality to understand the context of what they are doing, why it should be different, and that can bring change. But if you come from Accra and then say, I've come to, let's say, a village in BA, and you want to change everything overnight, they see you as alien.
Exactly. So you have to use the community leaders. So
yes, the entry techniques must be improved in all that. So these are social components of our education that we need to work on and a bit like divert from our traditional way of providing education.
Upper East used to be one of the worst. It's now one of the best when it comes to maternal health.
And it's all because they have there's education.
Exactly,
access.
and they've involved the community leaders. We call them Red Cross. They brought all the women, the leaders together. They've educated them, so they move from one house to the other, educating them. Or is anyone pregnant here? Go to hospital. Do this, do that, do. You understand? That's what is helping.
Well, thank you very much.
And it airs tonight.
Yes, so it's 6:30.
It's no, it's Monday 8:30 p.m. Then Tuesday 6:30 p.m. It's 4 parts, so 2 going this week, Monday, Tuesday. The next week, Monday, Tuesday.
Wow, 4 parts.
4 parts.
Wow, that's a Hollywood movie right there. But it's the reality of our times, maternal mortality, and how social, cultural, and religious beliefs seem to be impacting maternal mortality in our country and the state of pregnant women. We've had in the studio our own Seth Kwame Boateng, of course, who was honored over the weekend following that great event put together by MTN, Heroes of Change. Congratulations on that part. Where's the award? In your room, of course. Was money added?
I'm told, so it will come.
Wow. Great, congratulations. Give us lunch. We helped publicize.
Not only that.
Okay. And then also we've had Dr. Chris Opoku-Fofie. Thanks for joining. Opoku-Fofie. Thanks for joining me this morning. He's with the Greater Accra Regional Hospital, formerly Regional Hospital here in Accra. That great edifice just around the ridge roundabout here in Accra.